First, I just want to thank everybody for being on this call as well, and for your patience and perseverance in these uncertain times. I know this is new for everybody, but I'm pretty confident that together we're all going to get out of this. And the reason I have that confidence, again, is because our organization, the YMCA, has been around for over 175 years, and that we've been through wars and disease and recessions, and this is just one more bump along the road. So I'm sure that we're going to come out. Things might obviously look a little bit different, and there might be some changes. But that's one of the reasons we're on this call today, is because anyone who's running camp right now probably knows that your child care programs are looking a little bit different. So what we're here to talk about are some of those changes. What I wanted to share over the next few slides are going to be some new changes that we've seen kind of after talking to several YMCAs, kind of some new best practices that we put in place. Now, what I do want to preface this by saying is that we're not telling you you have to do this. I'm pleased that this does not supersede any sort of local or state regulations that you might have to put in place. We're not necessarily saying this is being endorsed by YMCA of the USA. All we're saying is these are best practices that we're seeing, that we're put in place to make sure that our programs are as safe as possible. So as we go through the next couple of slides, just keep that in mind, and I'll share what a lot of us are doing currently. So a lot of us have switched to curbside sign-in. The idea here is we want to keep parents out of our buildings, not to be mean about that, but we want to make sure we're limiting interactions, and if we can do the curbside, we'll do it that way, and making sure we're wiping things down every time. We're checking the camper temperatures every single day, as a precaution to make sure they're not coming into camp sick. And then if they do get sick, we're making sure we're calling those parents and reacting a little bit differently than maybe we would have in the past. And then as soon as our campers arrive, we're asking them to wash their hands. We want to sanitize them down, make sure before they start touching things that they're clean. And those are kind of the precautions that we're now putting in place that we're not used to for those of you who have always run camp. And then the one I put at the bottom here is a lot of camps have also implemented a sort of a questionnaire, a health survey, just asking parents basic questions. What's going on at home? Have there been any symptoms? Who are they exposed to? And again, as Kalina showed earlier, there are multiple examples of these on link right now. So if you, rather than creating your own, you can just steal one that someone's already created, or maybe modify it to fit your YMCA. And then also just as important as the camper health is we want to make sure our staff are healthy. Unfortunately, a lot of our staff probably are on furlough right now. So we want to make sure we're taking care of the ones we do have and making sure we're keeping them safe so they can continue to work, because if one of them goes down, it might not be a good situation. So a lot of our staff have been asked to start wearing face masks. Some people have made that a recommendation. We're asking our staff, obviously, to wash their hands throughout the day. If they have access to sanitizer, keep it on their person. We want to make sure they're doing that just as often as the kids. And then also we're checking our staff temperatures. It's not just okay to check the kids. We want to make sure our staff are coming to work, stick to it as well. So we want to make sure that that's just part of our new protocol. So the next couple things I'm going to talk about are keeping a safe environment. So a lot of people have heard the 1 to 10 ratio. So obviously to keep that, we need to have 1 adult and 9 children. So that, if you have the luxury of having multiple spaces in your YMCA, everyone kind of gets their own classroom or area, and that we're not ever crowding our rooms with more than 10. And when we get to those spaces, finding a way to make sure we're maintaining our 6-foot distance. Some of the creative ideas we've seen are people have started to put tape down on the floors, measuring off different areas, putting little X's or using cones. Rhonda, can you click the next slide? So just again, it's tough because we're always so used to having kids, kids are kids. They like to jump on each other, crawl on each other, but now we're retraining them that we need to stay 6 feet apart, whether we're walking through the hallways or where we're lining up to the bathroom, playing games. And if you can kind of recreate your physical environment to show what that 6 foot looks like, it might just help as we're doing things, because again, they'll get bunched up really quickly if we're not. One of the areas as we're sitting, obviously, is we used to put a lot of kids at different tables. So now we're trying to keep them separated. If you have the ability to have everyone have their own table, it's recommended. But if you don't have that many tables in your facility, then something like this picture would show, where we're kind of sitting end to end and they're kind of farther apart from each other. So it's tough because I know that we always want kids to work together, but in these times, safety definitely has to come first. And then kind of along those lines with the activities that we're doing is it's also recommended that we're giving kids their own supplies. Again, this kind of goes against all the things we've been training them to share with supplies. And then if you look at the next slide, you'll be able to see just a couple of examples of marking it off so that, again, the idea here is we're not cross-contaminating. We're not letting kids use things and having to sanitize nonstop. So if everyone kind of has their own bin, this is one example of an inexpensive way to do it so that everyone, again, just keeps their own supplies and they use the same ones every single day. Other supplies that we use, we got to make sure we're always wiping those down, whether it's, games we're playing with, sports equipment. A lot of people have been doing virtual learning so that whether we're sharing laptops or iPads or computers, keyboards, anything like that, making sure we're wiping those down. Also on this slide, I want to just kind of put another recommendation out there that if you have any sort of like soft surface areas, things like, bean bags, carpets, anything that is not as easily cleaned, I would recommend just not using those at this time because, again, germs can sit there a little bit longer than wiping down a hard surface. And then our daily cleaning, we've really had to step this up, obviously, as everybody knows, that we're wiping down everything. The things that maybe we're not used to as much, like in this picture, doorknobs, light switches. It kind of goes beyond just kind of wiping down the tables and chairs, but making sure that we're doing a good job deep cleaning things all the time so that we don't let these germs live in areas that are commonly touched. A lot of Ys have set up little stations or they might have different caddies around in different rooms just to constantly kind of encourage that the cleaning is happening and that there's easy access. So almost like, for those that have run summer camp, a lot of times we'll schedule group bathroom breaks just to make it easier than having kids always ask. And now a lot of people are doing is scheduling group hand washing breaks. So it's just another way to constantly make sure that those germs are not spreading and that we're killing them as quick as possible. So, and then make it fun too. So I'm going to stop there, turn it over to Julie. Those are just a couple ideas we've seen in a lot of camps that are kind of common right now. But Julie, if you want to see what else is out there.
Sure. So we've had quite a few questions that have come in regarding the slide deck. Chuck, I think people are really liking your graphics and maybe want to use those for their trainings. So we will definitely make the slide deck available on link underneath the resources where Kalina had talked about that. We had probably about 8 different comments about the graphics and getting access to that. So we'll make it available. We also had a comment from Angela who said that she has an amazing partnership with her hospital system and nurses are coming in to do those health screenings before the participants come into their program. So again, that can be used by your own staff or through partnerships that you have in the medical field, which is fantastic. And then we did have a question from Scott who had asked about when it comes to the groups of 10 and having one staff person for 9 children. And so wanting to get a little bit more information of why the one staff person for 9 kids.
Well, a lot of places have turned their group size. They don't want more than groups of sizes of 10. Some, again, this might vary local, depending on your state rules or local regulations. But if you're just using a basic group of 10, which is that's even came from the White House and the CDC recommendations to try to minimize those group sizes. So if we have a group of 10, then obviously we could only have 9 kids with that 1 adult.
Or if you need to add additional staff, you would have 2 staff for 8 children to be that group of 10.
Right, yeah. I mean, if those are your only kids, then you don't want that staff to be by themselves all day long.
And it looks like we've had a couple others who have mentioned that they also have nurses and medical professionals that are helping them with their health screenings. And there is a question of how are others utilizing outdoor space and cleaning when it comes to outdoor space?
We, I can space that a little bit, what we're doing here in Birmingham. None of our YMCAs have playgrounds, so that's one obstacle we don't have to, work with. but we are just, you know, if it's outside space, most of it is open air pavilions or fields. And so we have just a process where we're cleaning equipment as it's used. And, you know, some of our locations may have a bin that says used equipment, clean equipment. And so the children know, like when they're done using a piece of equipment, it goes in the bin that says used equipment. But you know, if we can, the best thing to do is we can get outside in the fresh air, and you know, there's really not a lot of cleaning to have to do except washing hands and cleaning any equipment that's used or touched while you're outside. Chuck, did y'all have anything?
Well, again, kind of on the, we don't use playgrounds. We just don't use them for safety reasons. So that hasn't been an issue for our programs in terms of having to clean them. And then the other outside space we use is generally on a grass field.
Great. We're having a couple different chats coming in saying as far as outside space, same thing, just cleaning equipment and using the field space so we can minimize the cleaning that is needed. We also had another comment from Scott who said he was on a Presidium call last hour from a lady in Florida. So maybe Chuck, you might be able to answer that, saying that their essential care is utilizing pools, and is anybody else utilizing pools?
We are not. We were our first week here in Birmingham, and then the health department issued an order to close all pools. So I think that's going to be something state by state based on what health orders they have there.
We are actually using our downtown indoor pool and busing each group one at a time on 15 passenger buses. So there's 8-9 children on a bus. They each sit on the windows so that they're separated, and each of them take different buses. So they keep the same vans every week to week and sit in the same seats. We drive them down and they spend 45 minutes in the pool. It's been great for us because the kids, they just love it. And we actually increased it from 1 day a week to 2 days a week.
So we do have a comment from Honolulu, Hawaii, who says that they're not using pools. So I thought that was fun to mention. But it looks like here, according to the chat box, it looks like it's per state and your health department. So check with your health department to see if they're allowing pool usage in your community. And I think those are all the questions as far as this section or comments. So we can move forward to the next one.